What happens when the pursuit of thin becomes more profitable than the cure for obesity? When a drug meant for chronic disease management becomes the next beauty filter, available to the few, desired by many, and misunderstood by nearly everyone. This is The Remedy with Dr. Rani Whitfield, and I'm your host, Dr. Rani. Today, we're digging into the complex, controversial, and rapidly changing landscape of GLP-1s. You know the names: Ozempic, Wegovy, Mounjaro, and Zep Bound. What started as a treatment for type 2 diabetes has become a $1,000 a month passport to thinness. But who's really holding the ticket? Who's being left behind? And more importantly, what are we losing in the process? This is Ozempic Bodies, Empty Plates, the New Weight Loss Divide. Let's rewind. We're in the middle of what the CDC still calls a public health crisis. Over 42% of U.S. adults are considered obese. Among Black adults, that number rises to nearly 50%. Hispanic adults, over 45%. And let's not forget our babies. 20% of U.S. children and adolescents aged 2 to 19 are obese, setting the stage for lifelong complications. Obesity is linked to more than 200 conditions, including heart disease, stroke, type 2 diabetes, certain cancers, and even Alzheimer's disease. And yet we spend over $170 billion a year managing it, not preventing it, not curing it, just managing it. Enter GLP-1s. Developed in the 2000s, GLP-1 receptor agonists were first approved to manage blood sugar in type 2 diabetes. These medications mimic the gut hormone glucagon-like peptide 1, which stimulates insulin release, reduces appetite, and slows gastric emptying. Translation: you feel full faster, eat less, and lose weight. For patients with obesity and diabetes, this is a game changer. Some lose 15%, even 20% of their body weight. We're not talking cosmetic results. We're talking about improvements in A1C, blood pressure, and inflammatory markers. For the right patient, it is revolutionary, maybe even life-saving. But like most revolutions, it didn't take long to be co-opted by capitalism, because now GLP-1s have made their way from the clinic to the culture. From Hollywood Hills to TikTok scrolls, Ozempic isn't just a drug, it's a status symbol. You've got influencers casually mentioning their O shots, celebrities debuting new bodies at award shows, and boutique wellness clinics pushing $1,200 a month injections with no real plan for long-term care. And here's where I have to pause, because as a physician, I've been watching this transformation up close. In my private practice, I'm seeing something deeply concerning. More and more people, many of them not obese, not diabetic, not even overweight by clinical standards, are requesting these medications. And many of them, they've forgotten about movement as medicine. They're not exercising, they're not strength training, not thinking about cardiovascular or brain health. They just want the shot, no sweat, no steps, no plan, give it to me quick. They're not asking about insulin resistance, they're asking about Instagram photos, about a dress fitting, a beach trip, trying to get to a number on the scale they haven't seen since high school. Let's call this what it is: a new wave of body dysmorphia masked as modern medicine. We used to chase six-pack abs with crash diets. Now we chase it with prescriptions we don't need. And look, I get it. We live in a society where wellness has been reduced to aesthetics, where health has a look, where thin is still treated as virtuous and fat as failure. But that narrative, it's costing us physically, emotionally, and economically. Because here's the other side of the coin. GLP-1s are expensive. Even with insurance, patients are getting denied or hit with copays of $500, $600, even $1,000 a month. And while celebrities post selfies and shout out their weight loss journeys, patients in underserved communities, many of whom need these medications, can't afford them, can't access them, can't even get time off work to talk to a doctor about them. This isn't just a medical issue, it's a class issue, a race issue, and absolutely a justice issue. Picture this: a single mother in a food desert. She works 2 jobs, has borderline diabetes, and wants to improve her health. But she's surrounded by fast food, convenience stores, and no access to sidewalks, parks, a gym, or a grocery store. She has a primary care doctor, but the copays are ridiculous, and juggling work and family leaves her very little time to schedule her appointments. She's not on TikTok, and she just is trying to survive. Now, picture a 28-year-old with a normal BMI ordering compounded semaglutide off an Instagram ad to lose 10 pounds to get summertime fine. We've made weight loss look like wellness, when in reality, it's become a luxury product. And just like any luxury, Not everyone has access. And don't get me started on the potential side effects. Muscle loss, often from not eating enough protein, hair thinning, nausea, bowel changes, specifically constipation, gallbladder issues, and let's not forget mental health. Some patients report increased anxiety or a strange disconnection from their appetite and body while taking GLP-1s. I've seen patients drop 25 pounds and still say, I don't feel like myself. Because weight is never just physical, it's emotional, psychological, and yes, spiritual. And when you lose weight without healing your relationship with food, movement, self-worth, you don't gain freedom, you gain new fears. So here's where I stand. GLP-1s are powerful tools. They belong in our toolbox. For patients with obesity, diabetes, metabolic syndrome, they work. But they are not shortcuts to self-worth. They are not replacements for community, cooking, conversations, or coaching your kids' team. They are not the solution to a system that's broken. My prescription for sustainable weight loss is to see a doctor on a regular basis. Get your annual wellness checkups and labs. Move your body daily. Movement is medicine. Prioritize strength, cardio, sleep, and stress reduction. Eat fewer ultra-processed foods and more real whole foods when you can. And focus not just on how long you live, but how well you live. We call that health span because the quality of your lifespan depends on it. Now, before I wrap it up, this week's book pairing is entitled You Just Need to Lose Weight by Aubrey Gordon, an honest, sharply researched breakdown of the fat phobia embedded in our culture and medicine. Read it, challenge yourself, and rethink the narrative. And your soundtrack for the week, the rapper Future, Mask Off. Because when the hype fades, when the filters fall, and when the medications run out, what's left? You, your body, your choice, your health. Let me leave you with this. The scale might move, the mirror might change, but you are not just a number and your health is not for sale. Your body deserves more than a trend. It deserves care. It deserves truth. This has been The Remedy with Dr. Rani Whitfield. And remember, we're born looking like our parents, but we die looking like our decisions. Let's make decisions that count. If this episode hits home, like it, share it, subscribe, and leave a comment. Join me every Sunday for a new episode on Spotify, Apple Podcasts, YouTube, or wherever you get your audio fix. It's the Hip Hop Doc. They call me H2D. Come on, y'all. Let's get hip hop healthy. Peace and blessings. I'm out.
The content on The Remedy with Dr. Rani Whitfield is for informational purposes only and is not intended as medical advice. Always consult with your healthcare provider for personalized medical guidance. Dr. Rani Whitfield is a licensed family physician, but the information provided on this podcast should not replace professional medical consultation.